Welcome. We are thrilled you are joining us today for the final presentation in our series, Navigating Today's Healthcare System. At this afternoon's presentation, Getting Your Affairs in Order, you'll be hearing from three wise, very experienced experts in the field. For those of you who don't know Ashby Village, we are a vibrant community of older adults and volunteers of all ages and backgrounds, transforming how we age. We make it possible for older adults to age at home with self-determination, community, and purpose. If you aren't already, come join us as a volunteer, a member, or both. Ashby Village presents our high-quality programming free of charge, so it's accessible to everyone. If you're able to support our ability to do so, there's a donation link in the chat. Thank you in advance. I will now turn it over to Barbie Jo Stim, a former geriatric case manager, an Ashby Village member, and a long-standing volunteer who currently welcomes and visits new members in their homes when they first join the village. All right, Barbie Jo, your turn.
Okay, hi. Welcome to today's presentation, Getting Your Affairs in Order, Essential Documents and Last Wishes. This blossomed from a workbook that was designed for Ashby Village members and will be available to members and those attending these presentations. As Oliver Wendell Holmes said, old age is only 15 years older than I am. And as my almost 5-year-old granddaughter Romy said to me this summer, Baba, how did you get to be so old? Old age creeps up on us. And we very much want to ignore it. And we need to be prepared. This workbook and the presentation will assist you in being prepared. Over a year ago, Joanne Carter and I, as members of the Ashby Village Welcome Team, were welcoming a new Ashby Village member in her home. And we always ask new members, is there anything that Ashby Village can help you with? The new members said, I could really use someone to help me organize all the documents that will be needed when I am no longer here. That's when the seed was planted to design a workbook for Ashby Village members that would contain all the information an executor of an estate would need to complete their task. So together with Joanne Carter and Marilyn Wiltz, we spent the last year crafting the workbook for Ashby Village members. But we couldn't have done it without the help of others, including Roberta Pressman, who has done an outstanding job putting together this 5-part series and graciously invited us to be the 5th part of this series. Roberta knew that Northampton Village had created a similar workbook and secured permission from them to use the workbook as a template for ours. I would also like to acknowledge Charisse Henshaw, who not only designed the cover for the workbook, but spent more hours than she bargained for editing and putting the final product in a form that could be easily used. I'd also like to acknowledge Raymond Ye. He is a volunteer and he has expert technical help. He took the document and put it in a fillable form on the web. Of course, Jessica Sterling was essential as she launched us at the beginning of the process and now at the end. It was a true team effort, and we are proud of this final product that will be available in the next day or two to all those who signed up for this webinar. The workbook will also be available on December 1st in the newsletter as part of a recap of this 5-part series. On January 3rd, Roberta and I will be at a table at the social hour with a hard copy of this workbook and a guide to visiting your doctor, and will be available to answer any questions that you have. After the 3 presenters speak, Sigrid Duisberg will be conducting the question and answer with our panelists. But Sigrid asks that you submit your questions in the chat box, after each panelist has spoken. So please don't wait till the end unless it's the last speaker. So now I have the pleasure to introduce our three wonderful speakers for this afternoon, who will be addressing various topics related to aging and this workbook. Anne Aronov will be our first speaker. Anne is a dear friend and colleague. Anne Aronov has been working with seniors for the past 15 years and has been doing case management with older adults at Jewish Family and Community Services since 2016. She works with Holocaust survivors and does private consultations with individuals and families and facilitates caregiving and bereavement support groups. Anne holds a master's degree in gerontology and arts education and is a certified massage therapist. Our second speaker is Joanna Smith. Joanna is a licensed clinical social worker and certified healthcare advocate. She has 30 years of professional experience in the fields of medicine and mental health. She graduated from the University of Vermont and then Tulane University School of Social Work. She has a master's degree in public health from UC Berkeley. Joanna had a healthcare advocacy practice from 2005 through 2020, working with families navigating our complex healthcare system. Today in retirement, she continues to work with people considering medical aid in dying and helps them understand their choices as they approach the end of life. Lastly, we have Rachel Dodson. Rachel is an attorney and principal at Ayoub Dodson LLP. Rachel advises clients in all aspects of estate planning with a focus on practical planning and administration. Her work primarily consists of preparing estate plans, administering trusts, and probating estates. Rachel is certified by the State of California Bar Board of Legal Specialization as a specialist in estate planning, trust, and probate law. She has been selected by her peers as a Northern California Rising Star from 2015 to 2023. So now I'd like to introduce Anne Aronov, our first speaker.
Hi, and thank you all for coming this afternoon. As Barbie Jo stated, I am a colleague and a friend, and Barbie Jo asked me here today to speak to you about some of the emotional barriers and resistance to actually doing these kinds of taking these kinds of steps that we're going to be talking about today. Now, I did have a look, and you will be receiving this wonderful book, workbook that they have put together. And it really is, it's a great template. And if you actually follow it and do what it says, it will really help you prepare for the future. But it's the kind of thing where I know that I would look at it and go, oh, that's nice, and put it away. And maybe think about it tomorrow or the next day or next week or next month. So this is what I really want to talk about a little bit, is what is it that prevents us from taking these kinds of preparatory steps? When we think about aging, we actually don't really want to think about it. We want to go along. We want to have our lives. We want to do what we like doing. And we don't really want to think about the issues of aging and the issues of losing some of our abilities. And so because of this, we kind of put off making these kinds of preparations because it's uncomfortable. It's uncomfortable to think about, and we don't want to, so we don't. So one of the things that I do in my work is I sit with people who have lost their people who are in bereavement process. And one of the really common things that I hear about is somebody whose spouse has passed or whose parent has passed, and that person didn't prepare. And so they don't know where the accounts are. They don't know the passwords. They don't know where the estate plan is. They kind of don't know where any of these things are. And some of them don't exist because people didn't prepare. So when you're coming up against this barrier of like, I don't really want to think about this, what I would recommend that you try to do is to have a moment of thinking like, how is this going to affect the people who are left, the people who I am leaving? And you really want to let it be easier for them to deal with what they have to deal with. So that's kind of my pitch for trying to make a dent in this preparation process. So I kind of break it down into 3 sections. There's like the paperwork, which is like all the papers, all the accounts, all the, the trust and the thises and the that's. That's a lot of paperwork, and it's a lot of work to get it in order. So there is a page towards the end of the workbook. It's kind of at the end, and it says, it's a very simple page, and it says account, name of the account number, and then there's a little section that says password. So I want you to really remember that page. And if you don't do anything else, fill out that page, because in this day and age of computers and passwords, your people need to know your passwords. They need to be written down. They need to be connected. Here's the account, here's the name of the account, and here's my password. People also need to know the password to your computer and the password to your phone. If you don't do anything else of all these preparatory steps, do that one. It's really important. I cannot tell you how many stories I've heard of people saying, I don't know the passwords. I can't get into anything. So I would really recommend that. The second big category that we're not going to discuss so much today, but I'm going to mention, is the stuff. So if you look around your house, how long have you been living in your house? Maybe 20 years, 30 years, 40 years, 50 years? You've collected a lot of things. Some of these things are very, very precious to you. They represent memories and trips and mementos. Some of the things, probably not. So it's a little daunting to even think about how to start. Like, where do I even start with organizing all of my stuff? So there are people in your community who can help you with this, who can help you start to sort and make decisions and say, oh, this could actually go in the garage sale, or, oh, this is really important to me and I want my children to have it, or my grandchildren, and this is why. And so you could start to make some plans around the stuff. And really, there's help. There are people who can help you do this kind of sorting. And the last part I would want to mention is the powers of attorney, which others here on this panel are going to talk more in detail about. But there are 2 basic powers of attorney. There's the power of attorney for healthcare, and there's a power of attorney for finances. So when you start to think about those 2 powers of attorney, if you haven't already prepared them, one of the things that you want to think about, and this can be very challenging, is to think about who this person should be. who should be, if you could not make decisions for yourself, who would you want to have be making those decisions, both financial and medical? Now, many people choose one of their adult children to be one or both of these powers. So again, this is a challenging thing to think about, but a very important thing to think about. Which of your children, and if you don't have children who you want to give this responsibility to, maybe it's a cousin or a friend or your you can't do your doctor, but somebody in your life who you are choosing to speak for you, should you not be able to speak for yourself. This can be a challenging thought, but you want to think about who in your life would actually be a person who would carry out your wishes. Now we get to a more crucial question is, have you thought about your wishes? And have you written them down? So these are the powers of attorney. One is for medical and one is for health, for finance. So let's talk a minute about the medical one, which is you need to make some decisions about what you want done in case of certain circumstances. If you could not speak for yourself, what kinds of measures do you want to have taken? What kinds of procedures do you want? So all of these kinds of questions are hard for us to think about, but very important, because the clearer that you can state your own desires and preferences, the closer your people can follow them. If you do not make it clear what you want, your people won't know what to do for you. So the clearer you can be and the clearer you can state it, the easier a time your people will have in following your wishes. And it will also, as you think about these things and possibly even talk with your adult children or whoever it is you're choosing, talk to them about the process. As you're going through it, talk to them about what you want. I know that's a difficult conversation, but it's an important one, because if you are able to speak with them, they will then really get what it is that you're asking for, and you will also be able to have a better idea of, is this adult child that you're choosing, are they really going to be able to do what you're asking them to do? That's an important question. And it's a process for everybody, it's a process of learning how to do these things. So these are sort of the big topics that I think about when I think about these kinds of preparations. And I know that for myself, when I speak to my young adult son about these kinds of things, it's not easy. It's challenging. It's challenging for him, and it's challenging for me. But I have said to him, like, I wrote down my passwords. Here are my accounts. Here are my passwords. I want you to know where I've put this in case something happens. I want you to know where my trust is. It lives in this notebook right here. I've spoken with my sister. You are my power person. Here's what my trust says. So it's challenging, but it's very, very important to make these kinds of preparations, even though these conversations are not easy. Here in America, we like to pretend that we're not aging. We like to pretend that, we're still youthful and we're doing our stuff. And we are. We are living our lives and doing our stuff. But it is important to remember that we are not in control of what happens next. And we never know what's going to happen to any of us. And so the more prepared we can be, the better it is for our people. And that's really what I have to say today to all of you. and I will be happy to answer questions at the end. So I'm going to introduce Joanna Smith, and I don't know how the transfer goes, but here we are.
Hello, everybody, and thank you, Anne, for that wonderful presentation. I will be picking up the threads from some of the topics that she raised and talking with you a little bit more in depth about it. Today, what I wanted to focus on were advanced directives, living wills, straighten out the confusion between the two of them, do not resuscitate orders, physicians' orders on life-sustaining treatment, and a little bit about medical aid in dying. And at the end, I'll talk a little bit about healthcare advocates who do what I do, and how they might be able to be of assistance to you all. So it's a big order, but I will try to keep myself on time with the 20 minutes. So let's start with the topic of living wills and advanced healthcare directives, because it's been confusing over the years. And if you're like many of the clients that I have worked with in my career, years and years ago, you filled out something called a living will. And the living will basically allowed you to stipulate in a very broad manner what you would or wouldn't like to have happen in the event that you weren't able to make your own decisions. Over the years in California, we migrated from the living will standard to the advanced healthcare directive standard. And while the names sometimes are used interchangeably, the big difference between a living will and an advanced healthcare directive is the directive allows you to appoint someone as an agent who will legally be able to make healthcare decisions on your behalf should you become unable to. So the big difference is that there's an identified person with an advanced directive that legally can make those decisions. In the old living wills, there was no one clearly identified to do that. So there were not a lot of protections, particularly for the healthcare providers, and there were a lot more gray areas. With the advanced directive, it's at least more clear. But if you've tried to fill out an advanced directive, you probably understand that there are many, many, many different versions of it. And not every version, interestingly enough, is accepted in every state in the union. So the important thing is always to look at an advanced healthcare directive and find out if that directive is accepted in California, because that would be the one that you would want to fill out. And again, all directives are not accepted in every single state in the United States. So we have a document now that is a document where you can legally appoint someone to make healthcare decisions on your behalf. The wrinkle to it, as Anne was alluding to, is frequently people choose an agent, but they never talk to them. So in my role over the years as a medical social worker in hospitals and as a healthcare advocate, we would get to the point where we would turn to the agent who was appointed by my particular, appointed by a client or a patient, and say, what do you think this person might like to have happen? And the agent will say, I have not a clue. We never talked about it. I don't really know what their wishes are. And frequently agents have actually walked away and said, I can't make this decision. I simply don't know. We want to try to prevent that from happening, which is why it's so critical for everyone when they want to appoint an agent to talk with the agent, make sure they're willing to do it, but even more importantly, to talk about what your wishes are, because otherwise they are just operating without any background information. And as we all know, healthcare is complicated. I always say the good news is we have lots of choices in healthcare. The bad news is we have lots of choices in healthcare. And unless your agent has some framework of how you think about things in your own brain, they're not going to be able to make decisions effectively on your behalf. So that's the big difference between a living will and an advanced healthcare directive. I'm sure of all the people participating today, many of you are probably Kaiser members. Kaiser is a very large HMO throughout California. Kaiser does have its own healthcare directive, advanced directive on the website. You can go in, you can work with their advanced care planning team. One of the things that I really like about the Kaiser Advanced Directive, as well as the California Hospital Association Directive and multiple others, is they allow you to appoint an agent, and they also allow you to determine when that agent's effectiveness, ability to make decisions on your behalf comes into play. So here's a scenario that sometimes happens: is someone does an advanced directive, appoints an agent, and says, if two doctors determine I'm unable to make decisions for myself, then my agent becomes the person that can make those decisions. So that is what we call delaying the onset of the agent's ability. But multiple directives have a little checkbox that you can check, which allows the agent to be able to make decisions on your behalf, starting immediately the day that it's signed. Always you will be asked first as the patient, and they will try to determine whether you're capable of making this decision before going on to your agent for possible decision making. Why is this important? Because sometimes things are gray in healthcare. Some days, if you've ever been around someone who has dementia, for example, some days are good days and some days are not so good days. Some days people can make decisions, some days they can't. Some days it's really unclear. If it's unclear, then we're in the bailiwick of trying to figure out legally, does this person have capacity or don't they have capacity? Do we need to involve the legal system to determine that? But if you've selected on your advanced directive and said, yes, starting the day that I signed this, my agent has the ability to make decisions on my behalf, then if the team thinks you can't, they can immediately go to your agent for decision making. And it cuts short all of the really complex capacity determinations that I imagine we're going to hear some from Rachel on. And it makes the progression from you to your agent much more simple and succinct. So it's a good thing to consider. It's a good thing when you look at advanced healthcare directives to see whether that has the ability for you to determine that your agent could start making decisions on your behalf immediately as soon as the document is legally signed. So briefly, that's generally about advanced directives. Many people like and use 5 wishes. It's a very popular one. I will say that the most recent version of 5 wishes that I've seen does not have that little checkbox, allowing the agent to immediately assume decision-making capacity. So to me, that is something to point out so that you know that you don't have the option of doing that with 5 wishes, but you can fill out the 5 wishes document and fill out a second document that does give you that ability and make sure that they're congruent with each other. Excuse me. Next, I'd like to talk a little bit about do not resuscitate orders and do not intubate orders, because this is probably what more people are familiar with when they're thinking about care at the end of their lives is, what do I want to do if my heart stops beating? What do I want to have people do if my heart stops beating? And do I ever want to have to be put on a machine that will breathe for me? And those 2 questions are extremely important. And I suggest to my clients, when you're at the point where you're thinking about those questions, it's really time for you to start considering with your healthcare team, filling out what's called it used to be called the physician's orders on life-sustaining treatment. In some states, it's called medical orders on life-sustaining treatment. In California, we do everything differently in California. In California, we're moving from physician's orders on life-sustaining treatment into portable orders on life-sustaining treatment. Portable because they're supposed to follow you everywhere you go. If you go in the hospital, those orders are supposed to go in right with you. If you go to skilled nursing, same thing. I suggest when people fill those orders out that they have their agent take pictures of them, keep them on their phone, keep a copy in the glove compartment of their car, because probably if they need to be acting as an agent, they're going to have to drive somewhere to assume those responsibilities. And you never can find the pulse when you want to find it. So it's good to have it located in several places. The beauty of the pulsed orders are that they allow you to express your wishes about what you want to have happen if your heart stops beating. And there are, I won't go into great detail today, but there are several different categories that you can choose. Anything from very, very, very aggressive, do everything, I want to live as long as possible, no matter what treatment, to all the way down to, I just want comfort care treatment. And as life goes on, your thinking about what you want will probably change. So will the pulsed form. So what we say is you fill out a pulsed form, you think about the questions, you fill out a pulsed form, you sign it, your doctor or nurse practitioner or physician's assistant now in California can sign it. And then it theoretically is put into your medical record. Again, I will say, having been in the emergency room with people who were frantically trying to find in the medical record where these pulsed orders are, always somebody should walk into the emergency room or the hospital with a hard copy of it, just to eliminate all those problems of where is it the most recent one, all of those questions that come up. So very important to go ahead and actually think about what you would or wouldn't want to have happen to you if you were in a serious medical situation. Do you want your heart to be, to try to, do you want them to try to restart your heart? Oh, sorry. Do you want them to try to restart your heart? At various points in your life, you may change your views about how aggressive treatment you would want to have. This gives you a chance to re-examine it as things change. You can fill out new pulsed orders. The one that is regarded as the current one is the one with the most recent date that's fully signed. So another way that you can ensure, as best you know, that your wishes are expressed. There's an awful lot that happens in healthcare that we can't see ahead down the road for. The decisions sometimes are really complex that agents need to make. So again, as much of an underpinning or foundation you can give as to what you would or wouldn't want, the easier it's going to be for everyone, for your family, for the agent, and for the healthcare team. So that's sort of physician's orders on life-sustaining treatment put in with do not resuscitate and do not intubate orders. So they all kind of flow in together. I do in my work now a lot of work with people in California where this is legal who are considering medical aid in dying. And for people that are not familiar with it, in 2016, there was a bill that was passed earlier in California that became legal, and people were able to actually do this in June of 2016. And what the legislation allows terminally ill people in California, meaning people with a life expectancy of 6 months or less, who have the capacity to make decisions for themselves, to elect to take medication that will end their lives, then that is guided by work with a hospice and with multiple physicians to determine whether they're capable, able, have the capacity, retain the capacity up to the moment that they actually ingest the medication. I think for many people that I've worked with, the important piece in that legislation is they wanted to have a choice. And many people get approved to take it, actually have the medication in their home, and don't ever end up taking it because they die through whatever the process is that they're going through of the disease that they have. But what many people have said to me is, you know, Joanna, what was really important is that I had the medication, I had it available. If I felt I really needed to take it, it was there and I could. So again, it's about choices and about people feeling that they have the control at the end of their life to make a decision about whether they want to go forward or not. There are at this point 11 other states in the country where this is legal, and there's an academy now of medical aid in dying medicine. It is a concept that is growing and is definitely legal in California. So with people that I work with, I always raise the question as we're doing advanced directives, we're doing post orders, is medical aid in dying something you would ever consider? And it just gives people a chance to think about it or say, no, 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 I would never consider that. I don't believe in it. I don't want to do it. And that's fine. But the question being raised, I think, is the important part. Even people in hospice, some of the hospices will not bring this up as a topic. If the patient themselves bring it up, then the hospice will work with them on that, but they'll never raise the question. So sometimes you have to be the one to do it on your own behalf. Little bit about healthcare advocates for general knowledge. So I'm a medical social worker. I've worked everywhere, inpatient and outpatient, and on the medical side and the mental health side. And over the course of time, I started seeing that there were a lot of people that I would work with in the hospital. They'd go home. We never knew what happened to them unless they showed up again in the emergency room. So I started thinking, what if there were one person that could follow you everywhere you went? If you were at home, they saw you at home. If you were in the hospital, they followed you in and did the discharge planning and made sure that the transfers went well, that the team was understanding what you wanted. If you went to skilled nursing, I would follow them to skilled nursing and then back home. So I could be in that complete system of everywhere they went. There was one consistent person to follow them through. And we all know there's a lot of people involved in healthcare these days. So it sometimes is difficult to keep track of who is really managing your care. So with someone like a healthcare advocate, that's a lot of what we do, and make sure that the team that's working with you understands what your wishes are, because I have those in-depth conversations with people. So we follow people everywhere they go. The next question everybody always asks is, who pays for this? Excuse me. And you know, the piece is that it's not directly funded under Medicare, although there are some more circuitous routes now where Medicare might put in some funding for advocates. Generally not paid for by systems like Medi-Cal. Mostly it's private pay. However, all of us doing this work that I know of have set up sliding scales because not everybody can afford to pay. And it's important to know that there are some people that work with people that cannot afford to pay at all. So the idea is to make your care comprehensive and understandable to you, most importantly, and then to others that are involved in your healthcare world. So it's people are sometimes called healthcare advocates, healthcare navigators, case managers, geriatric care managers. There's a lot of different names for it. I think the way that advocates differ from others is that we absolutely do not tell people what to do at all. If people say to me, what would you do if it were your mother or your father? I say, that's not really important here. What is very important is what you think you would most like to have happen for you. So we don't tell people what to do. We don't give second opinions. We're there to help you gain the knowledge and understanding so that the decision becomes your decision. I'll close with a great quote that I got from a friend of mine who's a clinician. And he said, you know what? Decisions aren't really made, they're found. And how they're found is by people gathering enough information and feeling competent enough to make decisions on their own. So it's not made, it's not like putting a list of pros and cons. It's really a found decision, and that's a very different process. So thank you all. I'll be happy to answer questions later. And I am passing it on now to our attorney on the panel, Rachel Dodson.
Hi, I'm Rachel Dodson. I'm an estate planning attorney. I'm super happy to be here. Anne and Joanna have done such a great job. I will probably be saying some of the same things that they have said, so please forgive me. But let me just do a quick intro. I work at Ayoub Dodson here in Oakland. I have been doing estate planning since 2013, and I'm currently teaching wills and trusts at UC Law SF, formerly known as Hastings. So I don't have too long to speak, and I have so many things I want to tell you about, but here's what I will tell you about. I'm going to do a brief overview of what documents make up an estate plan, a brief overview of how certain assets pass at death. I'll talk about when you should review your estate plan, what to do if you don't have an estate plan. And then I was monitoring a few of the questions as they were coming in. So I will make a note about capacity to make or update an estate plan. And then I just have a few notes about the Ashby Village workbook. Okay, so what is an estate plan? Estate plan is documents that you make to plan for your assets and for your decision making if you're incapacitated and on your death. So people typically think about estate planning for passing assets at death, but it is also to provide for who can help manage your affairs if you are living, but you need someone to manage your affairs for you. Estate planning is very state specific, so keep that in mind if you're ever being given advice from someone who's out of state or if you're looking for an attorney. California has different rules from other states, so what you may hear from other folks may not apply to you here. So in California, for most people, I would say probably 95% of my clients, the documents will include a revocable trust, a will, a power of attorney, an advanced healthcare directive. And sometimes there are some other documents, but those are really the core documents. A revocable trust is where you say what happens to your assets on your death and who is in charge of managing your assets on incapacity or on death. If you are married, you very likely have a joint trust with your spouse, so one trust for the two of you. In terms of naming who is managing your affairs, you can name a friend or a family member. There are also professional fiduciaries who will serve as trustees. So that's individuals who have made it their career to serve as fiduciaries. So trustees or executors or agents. There are also bank and trust companies you can name. So the trust is what a lot of people think of as their will. Often people call and say, I need to update my will, when really they have a trust, because that's where it says what happens to your assets. You do still have a will in your estate plan. It acts as a backstop to your trust in case you don't correctly or fully fund your trust. And I'll talk more on that in a minute. You will also have a power of attorney, and that is someone who makes decisions for you if you can't make them yourself. I did see a question in the chat about whether these need a notary. Legally, they only require 2 witnesses or a notary. But because mostly these documents are used to access financial accounts, so usually someone's taking this to the banks require that the form be notarized. So practically speaking, you should have them notarized, even though legally they are effective with 2 witnesses. And then there's the healthcare directive, which has been discussed already quite well by Ann and Joanna, but I'll talk about it a little bit at the end. I will say we do have links on my firm's website. We have links to the Kaiser form and to the statutory healthcare directive form. As Joanna noted, you can use other forms, but if in case you're looking for a place to start, we do have the statutory California healthcare directive form on our website. Okay, so let me talk about how your assets pass at death. So assets that you have in a trust will pass by the terms of the trust. The assets that should be titled in your trust, if you have one, is your house or other real property, your bank accounts, your brokerage accounts, and any business interests that you have. So you should check the title to your bank and brokerage accounts yourself. You can, if you look at a bank statement where it lists your name and address, it should say something different from just your name. So something like TTEE for trustee, or UA and have a date. So that's referencing a trust date. Or it should say, you know, TR or trust dated and have a date. That will indicate that you have properly put your bank or brokerage accounts into the trust. If you worked with an estate planning attorney, they most likely transferred your real property to the trust. So you probably didn't have to do that yourself, but that is something that you can pull your grant deed to make sure that it was put in your trust. You should also check if you refinanced your property after the mortgage on your property after you did your estate plan. It is very possible that your title came out of the trust, and you want to make sure that you put your house back in your trust to avoid the need to go to court. There are assets that are not in your trust and that should not and will not be in your trust because they pass by beneficiary designation. And that is a form that you do with the institution holding your accounts. So for retirement accounts, IRAs, 401ks, 403bs, there are many more, but those are the most common. And for any life insurance policies, those will pass by beneficiary designation. So you need to do the form yourself, either online or a printed form, to make sure that those pass to who you want them to. The other types of assets that do not pass through your trust, anything you have that is in joint tenancy, so that can be a bank account or your house can be titled as joint tenancy with someone, that will pass automatically to the surviving joint tenant, regardless of what your estate plan says. So those pass outside of probate and outside of the terms of your trust. If you have a bank account where you have named a pay on death or transfer on death beneficiary, so those are called POD or TOD. If you have named someone as a beneficiary in those accounts, those will pass outside of your trust. There is a pretty new thing where you can make a transfer on death deed for your real property. Those are a little bit complicated, but if you've done one, then that's how your real property will pass. And if you have an annuity, I can tell you how your bank account works and how your house works and how your retirement account works. I can't tell you how your annuity works. That is a contract that you have with the company that made the annuity. So it depends on what your contract said. Very often you can have a beneficiary, you can designate a beneficiary for that account to pass to on your death, but that's something you have to check with the company where you have the annuity. Okay. So maybe you're sitting here saying, yes, I know everything you're saying. I already have an estate plan. I just want to know when I need to look at it again. The list that we have for when to review an estate plan, if you have a significant change in your wealth, either an increase or a decrease, so that includes inheritances. If you have a significant change in wealth, you should check your estate plan. If you made a joint trust, so if you're married and you have a joint trust, if you did that before 2012, you should definitely review that plan because the tax laws changed in a certain way in 2012 that caused a lot of people to want to change the way their joint trust is. Not everybody, but it is something that you'd want to review. If you move to another state or if you moved here from a different state, you want to review your estate plan with an attorney. Other common reasons to review your plan is the death of a named beneficiary or fiduciary, the birth of somebody that you want to include. If you got married or divorced, you want to be sure to review your plan. And then just the passage of time. If it's, we tell people 5 years, I understand that life gets busy and time passes quickly. More realistically, people tend to come to us about 10 years after they've done their plans to review them. But it's, the things are always changing, both tax-wise and administrative trust laws change. So it's good to look at it if it's been a long time. Okay, so what should you do if you don't have an estate plan in place? You should not write your own will or trust. I'm not only saying this because I get paid to write wills and trusts. I am saying it because a lot of people say, well, isn't it better than nothing? Isn't writing my own document better than nothing? It is not better than nothing. It is very often worse than nothing. You have an estate plan. The legislature has provided for it. It says what happens with your stuff on your death. For most people, it's actually what they want. And if you write your own document, you're going to throw a wrench in the whole thing. Maybe you're saying, but can't I just go on LegalZoom and do it? Studies have shown that doing a DIY estate plan is effective for a very small percentage of people, like single-digit percentage of people. So I'm not saying it doesn't work for anybody, but it does not work for very many people. What you can do is your own healthcare directive. Those have been talked about a lot, and I will say a few more things about them at the end. You can do your own healthcare directive. You can name beneficiaries of your retirement accounts and of your life insurance so long as those beneficiaries are over the age of 18 and they are not on public benefits where them receiving assets is going to affect their benefits. So if you're naming an adult who can manage their own finances, go ahead and do that. And if you don't have an estate plan, I can't help but recommend that you talk with an estate planning attorney. I want to make a quick note about capacity. The standard of capacity to create or update an estate plan is very low. You just need to know who your people are. So am I married? Do I have kids? Do I have grandkids? And you need to know what your stuff is. You don't need to know every single dollar you have. You don't need to know every single account you have, but you do need to know, like, do I own a house? Do I have $100,000 or $1 million? Right? You just have to have a general sense of your people and your stuff. And you need to know the effect of what you're signing. So for some people, signing something, maybe it doesn't change anything. Everything was going to pass to your kids. It's still passing to your kids, right? Or maybe everything used to be passing to your kids, but now you're adding a gift to someone else. You just need to understand the change you're making. But you only need to know it at the time you are meeting with your lawyer and at the time you are signing. So sometimes we have clients call, maybe they say, my mom needs to update her plan. She's better in the morning. No problem. We will see them in the morning. They don't even need to remember that they met us later, but they do need to understand who are their people and what is their stuff when they're talking to us. actually a declaration of incapacity from a doctor. So say you have a letter saying someone has dementia. It actually does not necessarily mean that you can't make or update an estate plan. Obviously, sometimes it does mean that, but it is not definitive. So sometimes people can still do documents even after that. Okay. I looked at the Ashby Village workbook, which I think is really great, and I just wanted to point out a few items from that, and then I will pass it back for questions. So there was, I wanted to note something about locating documents. If you put your estate planning documents in a safe deposit box, you need to make sure that somebody can access the key to your safe deposit box and that the bank is going to allow them to access the box. This can be a catch-22, right? They need to have the documents to prove that they can access the box, but they need to access the box to get the documents. So if that's where your documents are, check with your bank now and make sure that you have whoever you want it to be approved to access the box and that they know where your key is. I also strongly recommend that you give them the contact information for your estate planning attorney who should have copies of your documents. Other than the healthcare directive, which I completely agree with what Joanna said and what Anne said, that you should give a copy of your healthcare directive to your agents and talk with them about your wishes. Other than that, I actually don't usually recommend giving copies of your other documents to people because you can change your documents. You can update them at any time. And it's not great to have a bunch of old versions floating around out there, but you should tell the people you've selected where your documents are and or give them the contact information for your attorney. In terms of the list of your assets and contact information, you should be sure to keep a list of your assets and contact information for anyone you've named in your estate plan. So whether that's the beneficiaries who are receiving gifts or the trustee or executor that you're naming, keep all their contact information with your documents and review that every year or two. A lot of people get worried because your trust will typically list your assets on the last page of the trust on your schedule of assets. And people get worried, oh, now I don't have that account anymore, or I sold that house. Don't worry about updating that list, just so long as you have an updated list of your asset information with your documents. Okay. A lot has been said about healthcare documents, so I don't want to hit you over the head, but I'll just make a few notes. So I think there's a lot of confusion about terms. So prior to the year 2000, there were durable powers of attorney for healthcare and there were living wills. So yet, as has been said, the durable power of attorney is where you named your agent to make decisions for you. And the living will is where you said what it was that you wanted. In 2000, there was a change in the laws, and that's when healthcare directives were created. Right? So that now both allows you to name an agent and to make decisions for yourself about things like organ donation, disposition of remains, pain management. If you have a durable power of attorney for healthcare or a living will, they are still totally valid. You don't have to worry that this law made them invalid. But if you have created your estate plan since then, you probably just have a healthcare directive. So don't be too worried about all these other terms. And then a lot was said about a POLST, the physician ordered life-sustaining treatment. The operative words being physician ordered. Attorneys do not make POLSTs, right? Doctors do. These are typically only done if you're going into surgery or nearing the end of your life. They are on bright pink paper. That's how you know it's different from your other document. They are always on this bright pink sheet of paper. And it only has you answer 3 questions. Do you want CPR if you're found not breathing, right? So that's the DNR. Do you want full, selective, or comfort medical treatment if you are found breathing? And do you want artificial nutrition if you cannot feed yourself? So the healthcare directive is a broader document. It allows you to answer more questions and allows you to choose agents. The POLST is a narrower document that just has those 3 items. So I know that was a lot really quickly, and we're going to move to questions, which we'll all be glad to answer.
Thank you very much, Rachel, and everybody else. Wow, so much information and so many questions, lots of questions. And well, I try to go to all of them, but it will be difficult. But let's see, let's try. The first question we got was, and that was a question that came back over and over again. If someone doesn't have children and only has friends and or siblings who are also elderly, who might they select to be powers of attorney? Are there professional options? And yeah, I think maybe Rachel.
Yes, so there are professional fiduciaries. There's two ways you can go about that. You can either go ahead and interview a few now and select some, or you can actually give someone the power to name a professional fiduciary when the time comes. So this can be a really helpful option if you don't need someone now and you think you're going to live another, 10, 15 years, and you're like, it doesn't make sense to choose someone now because they may no longer be in practice, or your assets might be significantly different, or your beneficiaries might be different. If you have someone in mind where you're like, I don't want them to be my trustee, but I trust them to choose a professional when the time comes, you can also do that. But yeah, there are professional fiduciaries, they're licensed, they're wonderful. We work with a lot of them. And that I think is actually an underused option for everybody, not just people who don't have friends or family. I think people who even do have friends and family don't usually realize sort of the magnitude of the job that they're asking them to take on. And I think a professional often is a really good choice for many reasons.
Mhm.
And there's bank and trust companies. Yeah.
Mm-hmm. When someone is beyond, that was another, the next question was a question that was asked a couple of times too. When someone is beyond choice, though still only mildly demented, what process is needed in California for making decisions for this person?
So I'll take a first pass at it, and then Anne and Rachel, because the wording, I think, of that question exactly expresses the amount of confusion that there is. So mildly demented is not a medical term. It is not a legal term. Everybody looks at capacity, which, as we said, can vary from day to day. So many times it is completely possible for someone to make decisions, maybe not at that exact moment, but they still do have capacity. Anne and Rachel, I'll just leave it there.
So yeah, it's a very complicated and complex question and issue. One of the unfortunate things that we see a lot in our work is people who legally do have capacity, because as one of you said, the bar is incredibly low. And again, like, this is a place where if somebody in your family is starting to have some issues, I would have a big family meeting and talk about this, because often what we see are people who really don't have good capacity to make good decisions for themselves, but they legally can still make their own decisions. And we see a lot of really, really difficult situations arise out of that kind of mushy landscape.
Yeah.
To put it really mildly, it can get pretty difficult.
I mean, I will just say, yes, there's a ton of gray area. At some point, yeah, maybe you're out of the gray area. They really can't make any decisions. If they really have not done any documents and someone needs to be able to sign something for them or make decisions for them, you are going to have to get a conservatorship, which means going to probate court and doing a bunch of documents. It's expensive, it's time consuming. This is why we do estate plans, in part to avoid conservatorships, but that is where you end up. If you need someone to make decisions and you haven't named anyone, people can go to court and get a conservatorship.
I'll just add one more quick piece to it, which is there are advance directives, although they don't have legal force the same way that other ones do, for to address the topic of dementia. So you can actually fill out a dementia focused advance directive where you express your wishes. They're quite detailed about if you are mild, moderate, or severely impacted. So again, it gives you the ability now, before anything happens, to put your wishes forward about what you would prefer if that's what happened to you. It just is not one where you appoint an agent, because that you cannot do that in California.
And the medical, it's also, like I said, the bar is incredibly low. And so if somebody, for instance, is like living on their own and insisting that they are fine, they can insist on that for really up until they fall and can't get off the floor. I mean, I'm not exaggerating. That's what happens. And so again, if you know somebody, or if you're in a family with somebody who's kind of on that decline, I would really try to have those conversations before you get to that point.
Next question. The persons whom I want to have my powers of attorney live on the East Coast. Is this an issue? For instance, would Kaiser consult with them or consult them? And I want to add something to that. Is it actually possible to have someone who gets a power of attorney when they're actually abroad in another country? So.
I'll take the first pass, and again, I think it's something we're all going to comment on. Your power of attorney, your agent on the Advanced Healthcare Directive, can literally be anywhere. The nice thing in California is you have the capacity or the ability, once you fill out an advance directive, to list it with the California Secretary of State. What that means is if you're elsewhere, emergency rooms, physicians have access through a back door to the Secretary of State's website, so they can see who an agent is that you've appointed under your advanced healthcare directive and locate them. So it's very important, if you do an advanced directive in California, list it with the California Secretary of State, so it's accessible to, this is only medical people that have the ability to find it.
Yeah, I'll just say briefly, we represent clients all over the country and some abroad who are serving as people's trustees or agents, and it's really mostly not an issue. There can be a tax problem if you name a non-US person as your trustee. So the person has to be a US citizen or living in the US. They can be not a US citizen, but living here, and that's fine. But otherwise, you could run into a tax problem if you name a non-US citizen living abroad. But otherwise, yeah, I completely agree. We don't really run into issues because people aren't here.
I would also just add, in terms of the medical, sometimes you might want to have somebody local for medical stuff because of timing. Like if somebody's, in a different state and it would take them, a whole day to get here, and something is really of the essence, like you might want to have a local person as well. But I don't know the legal implications of that.
Interesting question. Now, can one of you talk about the pros and cons of letting your executor know ahead of time what is in your trust, or is it better to let this come to light after you have died?
I mean, I mentioned that I don't necessarily recommend giving copies because you can update all your documents at any time. It kind of depends what this question is. If it's like, yeah, I'm disinheriting my kids and I want to avoid a fight, the way to avoid a fight is to tell them while you're living. Most people don't want to have that conversation. But yeah, other than that, I am not a very private person. I'm not big on not telling people things. And I will tell you, I named a different guardian for my son. And then when I saw that guardian with their own kid, and I thought, oh my God, you definitely cannot be the guardian of my son. Boy, was I glad I hadn't sent her a copy or told her that I had named her as guardian. So that's just my personal experience. And some people have a really long list of gifts of different friends and family member, and that can change over time. So that's the reason I say not to share it. But you should tell people you are naming as your fiduciaries where your documents are so that they can get them whether you're incapacitated or on your death.
Are two people needed for an advance directive, and one to serve and one in case person number one cannot serve? Also, to declare competency are two physicians required?
So, Anne, do you want to take up, or Rachel?
Yeah, I'm happy to. You know, we always tell people to name as many agents as you can. So if you have backup people, that's great. If you don't, then you name your one person, and if you can think of someone else later, then that's great. For incapacity declaration, it depends what your document says. So I know Joanna talked about that your healthcare directive can be effective immediately, which I also do recommend, and then no one has to declare you incapacitated. Your trust and your power of attorney and your healthcare directive all can say how you are declared incapacitated. At my firm, our default is one doctor or the successor trustee, so the person you're naming, can declare you incapacitated. That's our default. We're happy to talk with people and change that if they want. I think an old default used to be 2 doctors. I don't see that as much anymore because people realize it's pretty difficult to get, especially if you're in kind of an emergency and you don't have the time for that. But it's whatever the document itself actually says.
I'm curious, Rachel,
Yeah.
or Anne, about your thoughts on one other thing people have approached me on is they want 2 people on the advance directive, and they're not either or, they want an and. So 2 people as agents who need to agree with each other in order for a decision to be made.
Well, sometimes that has to do with, like, if it was a really difficult decision, like to not continue treatment, to allow someone to pass. A lot of times in families, like, siblings will disagree, you know, so somebody might say, I want them to be able, they have to agree, you know, there has to be an agreement. I have seen that kind of thing happen in families. And so maybe if you know that that's what your children are like, you would want them to have an agreement. So you would have to have them both agree. I don't think there's a legal precedent for that.
Yeah, this is what I tell my clients about healthcare directives. I'm like, I know what happens when I walk into court with your trust or your will, and I know what happens when you walk into a bank with your power of attorney. When you walk into a hospital with your healthcare directive, I can't really tell you what's going to happen because it depends on what hospital you're in. It depends on what's happening to you. It depends on if your agents can be reached. Is it an emergency or not? Did your doctor eat lunch yet? Did they have a bad night? Like it just there's so many factors. I worked for an attorney who actually would not let her clients name 2 people together. Like she would adamantly would not allow it. I don't go that far, but I don't love it when people want to name 2 people. There's just so many problems that can happen. I understand family dynamics and it's hard to name one kid over the other or whatever it is. So that's why I let people do it, but I don't like it. And I think you also have to think it's if they can't come to a decision, that is a decision. It's the status quo. So like if what you want is to not have your life continue if you're in vegetative state, but you've said your 2 kids have to agree and they don't agree, you're going to continue in a vegetative state, right? So that is something to think about of what is the failure to come to an agreement. It does mean something.
Right.
So in terms of the advanced healthcare directive not being valid in all states, if you have one in California, but something happens to you in another state or country, how does that play out?
Usually, I'll say usually, other states accept a directive that's filled out in a different state. However, there's a lot of cautions to that. It's one of the reasons I suggest people definitely list their advance directive with the California Secretary of State. it's just one more sort of place that an outside entity could go to validate the advance directive. I have heard reports of hesitancy on other states. If you're thinking about moving to another state, absolutely you should do an advanced healthcare directive that's recognized in that state. And that may not be the same one as in California. But states have different rules and different guidelines and different procedures, particularly about medical decision making. So there's a lot of questions, I would say, that arise there.
Yeah, other states are required to accept documents that are legally created in your own state. And you don't want to be getting in a fight with your medical provider, right? It's better just to have a new form than to try to prove that you're right. So yeah, they are legally required to accept valid documents from California. But if you're moving somewhere else, or if you spend 6 months a year in Florida, just have a Florida healthcare directive also, instead of trying to prove that you didn't need one.
There's a question if wills actually remain in effect, or if there's a date when the document is no longer in force.
Yeah, your will is effective until you revoke it or make a new one that supersedes it. So even if you did it in 1970, it's still effective. It probably needs to be updated, but it is legally effective.
There were two questions about documents and if they can be put in the chat. I mean, one was the 5 wishes that I think it was Joanna who mentioned that. And then the other one was the POLST form. And people were asking if that could be put in the chat. So the links.
If I'm still not clear on the question. What were they asking?
They wanted a link to the POLST form. I mean, and also a link to the 5 wishes that I think one of you actually mentioned.
Right. So POLST, I would say the easiest way, and you'll filter down to the different states' versions, because all states have different versions of POLST. Some of them call it MOLST. It's www.polst.org. And that will feed you into a national database that will let you choose state by state. 5 Wishes was 5wishes.org, and you can get the form right there. Your doctors, everybody, the hospital, your doctors, your outpatient, everybody's got POLST forms that they will give you. So you don't really need to go searching, and you don't need to go pay for it. They're all available.
There's a question about medically assisted death. Does a hospice have to be in the loop for medically assisted death?
We encourage it because hospice is extremely supportive to not only the person involved with medical aid in dying, but also to their family after death. So it's a whole system of care for the entire family. It's not, however, a requirement under the law that hospice be involved.
Please, this is more a comment, please highlight that it's important to safeguard the highly sensitive and confidential information in a filled workbook.
We're all agreeing.
It's been highlighted, yeah.
Is there a panel of healthcare advocates, a list of referrals, and is there a name of a professional organization?
So there's multiple professional organizations because it's a growing profession. I founded the National Association of Healthcare Advocacy. They have a database. Health Advocate X has a database. There's the geriatric care managers have a database. There's many different ones that you can use to look for advocates and case and care managers.
And I would say that care managers generally, like what we do at JFCS, is not so much the medical. Like if you have a complex medical situation, we often refer to medical social workers and medical case managers because they are more skilled at managing complex medical situations. We will support family caregivers who are dealing with those kinds of issues, but we don't do the actual hands-on medical advocacy. That would be more in Joanna's field.
Right.
There are lots of questions about that. Yeah, case manager, how to find one, and fiduciary, and also actually what the costs are for. I mean, I have a question here. What are the anticipated charges for a case manager or healthcare advocate if I want to appoint someone for myself? And another question: what are the charges for a professional fiduciary during my lifetime when I have capacity?
So, Anne, do you want to start with, because I'm in the private world, I'm in a different,
Right.
category.
So Jewish Family Community Services has different kinds of programs of case management. We do have private pay and we have sliding scale for case management. We currently, so in our current capacity, we do consultation. So in other words, like if you are at the time of your life where you're like, I'm not quite sure where to go. Like, do I want to stay in my house? Do I not want to stay in my house? Like, there's a lot of issues and you need help sort of sorting through those kinds of things. We will do consultations and we can do sort of periodic case management. We don't have the capacity right now to do really intensive hands-on, taking you to the doctor kinds of case management. So that we would refer you to somebody else for that. And we do have some kinds of programs. We have a family caregiver program where there is no charge, and that's sort of a counseling and support system for you and your family. That's the kind of case management that we are currently offering. And as I said, if somebody has a very complex, really need of high need hands-on medical case management, we would refer. And it is all private pay for case management, and we do have sliding scale.
I would say, because everybody asks the same question, it's a good one. How much is it going to cost? There's a wide range all across the country. For many people, there are situations in healthcare advocacy where the advocate really can work nationwide. So you can do a lot of shopping. There's a pretty wide range. I'd say the very low end of what I've seen nationwide is $50 an hour. The very high end, which tends to be more where the Bay Area pushes, is somewhere between $200 and $250 an hour. But a lot of it really depends on what kind of advocacy you need, and you want to make sure that the advocate that you're thinking about hiring, first of all, has a service agreement that's quite detailed and explains what their training is, what they do, what they don't do. I'm happy to talk with people about questions about healthcare advocates if they want to contact me just to get more information. But the most important thing I would say with an advocate is looking for, do they have the skill set, as Anne's talking about, to actually be able to help you. So if it's something that's technically medical, you would really want to look for someone probably who's a physician or a nurse doing advocacy, because they have that set of expertise. If it's something about placement or setting up caregivers for the home, that might be something, is that right, Anne? That people
Yes, that's the kind of, we do that all the time.
You could turn to
If you
Anne
need home
for.
care, we will help with setting up home care, or if you need some modifications done to your house, we can refer you to people who will do those kinds of modifications, that kind of.
Right. So it really depends on you knowing what it is you need help with, and then finding people with the skill set that can really help you do what you want to do.
I'll just answer briefly for professional fiduciaries. They tend to have their fees either as a percentage of your estate or hourly. Reasonable is generally considered to be 1% of the value of your estate annually. The hourly rates tend to be about 125 to maybe 250.
And the professional fiduciaries, that's a very specific job and certification and all kinds of legal requirements to be that kind of a person. So you want to make sure that the person you're hiring has all of those certifications.
Yeah, somebody asked if there's some supervision. I mean, who supervises the professional fiduciary and can, no.
They're licensed. So there's an organization called PFAC, Professional Fiduciary Association
Association of California.
Yeah. And they list fiduciaries, and yeah, they're licensed, they have continuing ed requirements, they have to be bonded, all those kinds of things.
Yeah, and there was another part of that question asking, can the professional fiduciary serve with a relative or a friend?
Yes, you can have co-trustees or co-agents, and one can be professional and one can be not.
The difference between a revocable versus the irrevocable trust, and why choose revocable versus a revocable.
Yeah, I wish they were called something else because they sound like they're almost the same thing when really they're not the same thing. A revocable trust is basically a will replacement. So the point is that you're trying to avoid probate court, and you're trying to avoid it because it's very expensive and it's very time consuming. So if you make a revocable trust and do it properly, you'll avoid the need to go to court. It also provides for incapacity, right? So someone who can manage your affairs for you. An irrevocable trust is mostly used for tax planning or for creditor protection. So if you have a taxable estate, which right now means a married couple with over about $27 million, or an individual with over about $13.5 million, they maybe set up irrevocable trusts for fancy tax planning. We actually don't do that kind of planning here. I think the big confusion is that your revocable trust is a revocable trust as long as you're living. It becomes irrevocable at your death, but it's not the same thing as setting up an irrevocable trust now to do this sort of tax or creditor protection planning. It gets extra confusing because sometimes people name their trust like the Rachel Dodson Revocable Trust, and then after my death, the trust stays the same name, but now it's irrevocable. So I think that adds to the confusion that already exists. But for the sort of average person, you would just have a revocable trust that would remain revocable until your death.
If you are married, is your spouse automatically your power of attorney in case of incapacitation?
No.
Even if you haven't named someone else?
Correct.
Oh.
Yeah, there's no automatic. They'd have to go to court. Your spouse has the highest priority for being the executor of your estate or your conservator if someone has to go to court. There actually is no order of priority for healthcare decision makers, which is how people get into big fights about who gets to make healthcare decisions. So yeah, if you haven't named your spouse, they are the first order of priority to be the executor of your estate, and to be your conservator, but not to make your healthcare choices.
Yeah, and that's again where it gets thrown back to the healthcare team, because then they're really trying to sort through a very complicated situation without anybody that can make really clear guidance. There have been times when two people appear at the bedside of a patient and it turns out that one of them was formerly married, but they're divorced, but have very strong opinions about what should happen. And then there's a second person there and nobody has the actual legal right to make decisions. So it creates a very complicated situation.
Yeah, we see a lot of spouse versus mom situations, and it's bad. Yeah.
What are the pros and cons of putting your child on the title of your house?
Oof, that is too much to go into for today. I will say do not do that lightly. Do not go make a grant deed just adding your kid. There's a lot of reasons not to do it. And there you can mess up your property tax basis if you take them. You don't want to get your property taxes reassessed. and you don't want to be making a gift of property and then having to get an appraisal and report the gift, and just don't do it. The things people do with their grant deeds shock me every month. Yet people think of new things to do with their grant deeds. I know it's not fun to call us and pay us and record things and do the whole thing. Trust me when I say you are saving money having an attorney do something with your real property. Believe me.
How do I set up funds access so someone can use my funds for my care during my lifetime, pay my burial expenses on death, and then distribute the remainder?
Sounds like
So that
Irrevocable
again,
trust.
right.
Yeah.
But also that again speaks to like, have this conversation with your people. Like, let them know where the money is, how to access it, have an account with your adult person's child's name on it that they can just use the money to help take care of you. Like, however it is you decide to do it, you have to have the conversation and set it up, because otherwise it's a problem.
If legally married people are both owners of a bank account, do you need to retitle it to the trust?
If your account is outside of your trust, it will pass to the surviving joint tenant. So if it's like Rachel and Mike on a bank account, if Mike dies, I have the bank account. That doesn't provide for what happens if we both die. That doesn't provide for what happens if we're incapacitated and someone needs to reach those funds. So from a legal perspective, the best thing you can do is transfer it to the trust anyway, because then you are providing for all these other contingencies.
What do you think of the knock box? I think does that say something to you? Knock box. I think it's probably a book or something that you can buy. It says here, what do you think of the knock box and compared to the upcoming Ashby Village workbook? So
I don't know what that is.
I don't either. Can somebody put on a clarification of what they meant?
No, next of kin,
Kin.
knock box, next of kin. But that's like a box that you give to them? I
Maybe it's just another organizing tool.
So it says it's
I
a
mean,
product.
Yeah, so these
I
are,
guess, yeah. Go
I'm
ahead.
guessing it's a similar product. It's a similar tool. These are just tools for organizing your stuff. And there are many of them. I think that the Ashby Village one is excellent. So you might.
I think I know now, I mean, that you say that, I think there's a lot of stuff like that on Instagram these days and Facebook.
Oh,
And it's actually, I think it costs about $200. It's a box, where you have all kinds of folders in there, with different whatever is needed, and so that your kids, when you die, know everything, and don't have to.
I mean, I'll say this, you guys are here, you are listening to this talk, you clearly care about this, you are probably getting things in order. It doesn't matter if you do it with this workbook or that workbook. You don't have to follow every single thing. We have clients coming here every day, right, where someone's passed away and they figure it out. So do you want to be organized? Yes. Do you want to have your list of stuff? Yes. Do people figure it out if you haven't done it perfectly? Yes. So if you prefer the knockbox, that's great. The Ashby Village workbook, I looked at it, it was excellent. I think some of these things are just, it's sort of like healthcare directives. It doesn't actually matter all that much which one you use, as long as you use one and you sign it and it's legally effective here.
and you have to let people know where it is. I mean,
Yes.
it's in the purple binder or whatever you
Yes.
identify. Just make sure people know the purple binder and what shelf it's resting on, because
Yes.
that's where they'll go and everything will be there.
And like we've all been saying, like, if you can't do it all, that's okay. Just do,
Some.
your healthcare power of attorney and write down a list of your accounts and your passwords and have a trust. Like that's, like if that's all you do, that's good. That's a good start.
You'll be doing much, much more than the average person.
Right.
Yes.
What legitimacy do digital copies of various documents have?
So if I don't know if they mean PDFs, by digital copies, you cannot sign documents electronically. But yeah, mostly we do use PDFs these days. The only time you really need an original of the will is if you're going to probate court. So if you're probating your estate, you do need the original, ideally. But mostly we don't actually need original documents for most things.
The post is a piece of paper, and it's like somebody said, it's a big pink piece of paper. And usually when we are like setting up home care for somebody who is elderly and frail, it is always asked, like, do you have it and where is it? And it's literally that piece of paper that people put on the refrigerator in case 911 has to come, then they can see what you've said on your post. So it's those are the ones that, like, a digital copy of that is not going to help. Like, it needs to be the actual piece of paper.
Yeah. Right. I mean, a post is for emergencies, right?
Right.
So you want it. That's why it's bright pink, and that's why it's on your refrigerator.
Right. And that's why it's a piece of paper, right? It's
Right.
not on the
Whereas,
phone. Right.
you know, someone passing away and us administering an estate obviously can feel really devastating and all those things. It's actually not an emergency, and you do have time to go find documents. Yeah.
When is a declaration of incapacity really needed? Is it needed?
Well, in estate planning, you know, if it's really needed if somebody can no longer manage their own affairs and someone needs to access their accounts. And if the trust says, in order for this person to begin acting, they either need a doctor letter or the trustee declares them incapacitated, whatever it is, then that's when you need it. Is when they actually, you're living, but you have dementia and someone needs to go access your accounts to manage your care.
And someone asked this, did you say that beneficiaries cannot be minors? I think that's what you said, right?
You can have beneficiaries who are not minors. You just don't want to name them outright. So yeah, I had said that about naming beneficiaries of your retirement accounts. I'm not saying you can't name minors. You just wouldn't want to name them outright, because then you're going to end up having to get a guardianship estate going through court, and that is not what most people want. So if you are wanting to name minors as your beneficiaries, you should do an estate plan. You should get a trust.
Yeah, someone asked about the post that I read recently that it's useful for EMT people in an emergency situation, which implies it might be useful to fill out well in advance of a problem, correct?
Yeah, I think the thing about the post is because it really asks about what level of care you want. It's an important document to keep refilling out because your concept of the care you want is going to change over time. And I see someone was asking, does it have to be pink? No, it doesn't have to be pink. You do not have to print out your form on a pink piece of paper. The beauty of pink is when the emergency team goes into your home, they're looking really quickly to see where is that pulse. And if it's bright pink and it's on your refrigerator, it's very clear to them. And the beauty of the pulse is it literally gives them orders they can follow. These are EMTs. They need orders in order to do or not do certain things, as well as communicate with their base. So no, it does not. The Kaiser form, you do not have to print out on a pink form, pink paper.
And here's a comment by our Roberta Pressman. You can find the form to fill out your wishes should you become demented at a later point on the Compassion and Choices website. And the website is compassionandchoices.org. Question for Joanna. Does Ashby Village have a referral list of healthcare advocates, including her? If you find one person, can you use them intermittently as needed?
Oh, sure. You can use people as much or as little as you want, and that's something to talk with an advocate about. I will say, mostly retired, although the mostly seems to vary day by day. And I, at this point, do consultations with people, happy to help you get to the right person if it's not something that I can do. As far as I know, I'm listed in Berkeley Parents Network. That's where a lot of Bay Area people have found me. I don't know, does Ashby Village have any lists of, like Jewish Family Children's Services and advocates and
Yeah,
I think they do.
yeah, we have a list called preferred providers, although this doesn't come directly from Ashby Village, it actually comes from our members who have used providers.
okay.
So
Great.
yeah, your information will actually be accessible anyway, because there will be an email going to everybody who was on the webinar today, and it will have all the information in there. So yeah. To the attorney, Rachel, can you go over when a new estate trust is needed versus an amendment to the original trust? If a time passes, would that be a good time to do a new trust?
I'll start with the last question. If a bunch of time has passed, it's a good idea to have your trust reviewed. I'll say every so often I review a trust that's 15, 20 years old, and I say, if this still meets your wishes, if these are all the people you still want to name, you actually don't need to update this. More often, though, if it's an older document, I look at it and I say, oh, there's been, these changes in the laws, and you'll want to update your trust. I would leave it to your attorney to decide if you need an amendment or a restatement. At our office, we are more often doing restatements. That means we're taking out all the words and putting in all new words. The reason we do that is it's actually less expensive for our clients if we do the restatement, because then we don't have to review every provision of your old document to make sure it has what we want it to have. So we just do whatever's more efficient, which is code for cheaper for our clients. Every so often we do an amendment, but it's actually pretty rare. So I wouldn't really take it to mean one thing or the other. If your attorney chooses one over the other, hopefully they're just doing what's most efficient.
Question for Joanna. Do you have any information regarding where to get training to become active with medical aid in dying families?
Well, yes. What an amazing question. Yes. So there is an academy at this point, American Clinicians Academy on Medical Aid in Dying. And it was started by Lonnie Shavelson, who's a Berkeley physician. And now there are thousands of people involved in it. And one of the things that we're doing, we hope to complete it in 2025, is we're doing pathways leading to certification in medical aid in dying for all different kinds of professionals, for nurses, for physicians, for chaplains, for social workers, for end-of-life doulas. So people will be able to get the training that they need in order to participate in medical aid in dying. Everybody can do different parts of it depending on what their abilities are. I'm a medical social worker. I work on the family side. I get hospice involved. I find physicians. I do all of that. I will mix the medication. I'm with the family and person at ingestion, but everybody does different pieces of that. There is a list on the Academy website, and I'll put the URL in the chat, and you can go in there and find doulas and social workers that can assist. And I will add that in right now.
There was another question about polls. Besides putting it on the refrigerator, are there other places where you should keep it? I mean, give it to the doctor, for example, add it to the trust, or?
I do want to say one thing. I mean, the post requires a doctor to sign it for it to be effective. So it's not like the healthcare directive that you can, or a medical professional.
Right.
Not like the healthcare directive. That's the only document I recommend people can just do on their own, get 2 witnesses or a notary, and you're good. A post, you sign it and a medical professional signs it. So, if you're doing it at Kaiser or at the hospital or wherever, they will have a copy of it. I just want to point that out. So that, it's not a form that we do for our clients ever, because it's not for lawyers to do, it's for medical professionals to do.
I'll just put in again that my encouragement is that people have that document stored in multiple places with multiple people, because in an emergency, I can't tell you how many times in the emergency room, people are thumbing through the medical record, thumbing on the computer, trying to find the most recent document. If you walk in the door with it in your hand, they're going to run with it. They need to move fast. They need the information. They got to run with it.
And I have seen them displayed in people's homes in really different, like in a plastic sheath, on the banister, or just in somewhere, like depending on your home and where the person, like this was a home where the person who was incapacitated lived on the second floor. So any EMT who was going in there to get them out would have to walk by it, right? It was like right.
That's brilliant. Yeah.
It was great. And so depending on the situation, if you want the physical piece of paper, it just needs to be somewhere visible.
And if somebody's in assisted living, all the assisted livings have their protocol. With some of them, it's on the inside of the cabinet, upper cabinet door over the stove or whatever. The EMTs know to go to that facility. That's the door that you open to find it. So there's tweaks to it.
There was a question about disposal of bodily remains. Is it recommended to pay for a plan ahead of time or adequate to stipulate your desires and leave enough money in your estate to pay for it post-mortem?
So again, this is something that is difficult to talk about with your family, but is really important. If it's important to you, what happens to your body, you need to let everybody know. And that's a challenging conversation, but an important one, because there are many choices and there's a really wide range of how much those things cost, from nothing to really a lot of money. So again, this is a conversation to have with your family and to make a plan, if possible, or at least let them know what you want or don't want.
Yeah, I think we're coming to an end. I mean, that's such a great Q&A and so many good questions. And yeah, I want to repeat actually two websites that many people are still asking for. One is about the polls form. It's www.polls.org. The other one is www.5wishes.org. That a lot of people asked for that one too. And then, Joanna, did you put that already? Oh yeah, no. Did you already put that in the chat?
Compassionate Care California.
Yeah,
is the other one.
Okay. Yeah, compassionate care. Okay. What else do we have here?
Oh, the EMT question. No, this pink piece of paper, the reason it's a pink piece of paper is so people can find it easily, but a non-pink black and white copy is as valid as something on bright pink paper. So don't worry, you don't have to go out and get pink paper. Just make sure the right people have it and it's in the right place.
Yeah. And there was something about end-of-life doulas. Do you know about that, or can you say?
Yeah, I was saying, if you go on to the American Academy of Medical Aid and Dying, there's a referral list, and list people that help with the whole end-of-life process. They also have referrals if you need a physician to help with the process of writing the prescription or being a second opinion.
I think that was it. Thank you so very much. I mean, for your time. This is amazing. And also quite a few thank yous in the chat. And yeah, amazing. And I just want to say again, thank you to everybody also that was part of that webinar today, our audience. And there will be actually in January, as mentioned before, at the social hour and pre-social hour, there will be some of the material will be distributed there. So more information, though, will come in the email that you will get in a couple of days. And that email will have a lot of information about today's webinar, about our YouTube channel, where you can actually watch this webinar again. And not only this webinar, but the other 4 parts of the Getting Your Affairs in Order, Navigating Today's Healthcare System series that we had in the last couple of months. You can watch them there, all 5 of them. And last but not least, I would want to also mention that although, I mean, these events, these webinars are free for everybody to attend, Ashby Village also relies on donations to bring such programs to you. So if you feel like it, I mean, the donation is greatly appreciated. Again, many, many thanks. And yeah, thank you. Have a nice afternoon or rest of the afternoon.
Thank you.
Thank you.
Thank you.